Hello, everyone. Thanks for joining us on the media briefing for this Wednesday. We expect to have Dr. Moreno on the call for us shortly. I don't yet see him here, so I believe we're fortunate to have another one of our guests on, Brian Flores, involved with county parks. And Brian, I hope you don't mind if I call on you first and jump in to talk about the Toro Park reopening. I know you were scheduled for a little later, but I see you in the car and you're good to go. Your sound is a little low.
Sorry about that. Too far away. Okay, there we go. Trying to get a more scenic view for my backdrop rather than the truck.
Thanks for letting me jump and call on you a little early.
No problem. Would you like to ask questions or just
how about if I'll start you off with a question and you can take it from there. People have really been looking forward to when Toro Park will reopen after fire and recovery, and I'm hoping you'll give us a date and tell people what they need to know about using the park again.
Sure. Well, it has been a strenuous and difficult 8 months since the park's been closed. We've been working hard, staff and volunteers, and some community groups to get the trails back in shape, and some infrastructure work done. But I'm happy to say that we will be reopening Toro Park this coming Monday, the 19th at 8 a.m. And the main thing that we really need people to be aware of is that Toro Park is still in this healing process and will be for a number of years. And some of the natural barriers that, such as the chaparral bushes and things like that, are no longer there. And so it would be very easy for a person to be on one trail and see another trail across the canyon and kind of cut across that burned area where there was typically manzanita and sagebrush and things like that growing. And so we really need people to stay on the designated trails, to be sensitive to this area. You know, their footprints could cause, erosion in the future, or if, new trails get made and things like that, as well as wildlife. A lot of wildlife was displaced, pigs, turkeys, bobcats, probably the occasional cougar here and there. But we really want to stress that people should not approach the wildlife just any time, but more so now, in that they are stressed and may not react the same way as they typically do. And then just be sensitive to the fact that, Toro is healing. Don't pick the wildflowers, don't trample through areas that are not designated trail, and things like that.
Sorry, I'm not being very conversational about that, but I have 1,000
Does anyone have questions?
I'm trying to get Sarah in the apartment, comment, etc. Period, new paragraph. I will promise to take some time with all of this evening.
Man?
Go ahead. Sorry, I was on mute too. For trying to find the person who was unmuted. I'm wondering if you could tell us if there are any changes to the park in terms of using some of the facilities, the picnic areas, or any fee structure changes.
Sure. We did have our new fee schedule go into effect April 8th, and that we were a per person charge for the past couple of years. We've gone back to a per car charge for drive-ins. So for a vehicle with 4 people or less, it will be $10 entry. For cars with more than 4 people, 5 people and above, it will be $15, and then $5 less on both of those for veterans, seniors, children 0 to 4 are free. 5 to 18 children or students with a valid ID or $1, as well as veterans and seniors. Walk-in fee still remains $2 for the general public. But other than that, it's pretty much the same as it has been. We were able to re-slurry the blacktop on the basketball court, So that's nice and fresh. We're replacing sand in the 4 volleyball courts. So that will be open. We want to stress that people should follow the COVID-19 protocols, avoid the large gatherings, that type of thing. So adhering to the good advice from CDC and Monterey County Public Health. But other than that, pretty much the same operation as it has been. And a lot of people may not even realize that the park was burned. Much of the area is green, wildflowers are coming back, and other than some singed trees in the lower portion of the park, you wouldn't ever know that there was a fire. But as you get up on some of the peaks and some of the backcountry areas, it is still barren in a number of locations and moonscaped on the top of the peaks and things like that. So, people just to be careful. There are, don't try to climb up in the burned out tree to get the selfie shot and things like that, and stay on the trail and be respectful of nature and the park.
All right. Thank you very much, Brian. And I'm hoping you can relax a little bit in your car out there in that beautiful environment and stay on the call for some questions after everyone else is done. Thanks.
Okay.
And now we'd like to turn to Dr. Moreno, who is going to join us this afternoon for a COVID update. Good afternoon, Dr. Moreno.
Hi, Mia. Good afternoon. So I think my update is brief, but I'll be happy to do my best to answer questions. Here in Monterey County, we've been able to, the collection of vaccine providers here in Monterey County have been able to vaccinate about 48% of Monterey County residents age 16 and older. That's the percentage of people who received at least one dose of one of the 3 vaccines available to us here. And starting April 15th, all individuals 16 and older will be able to receive a COVID-19 vaccine. I encourage everyone that's eligible to be vaccinated to schedule an appointment. And if people are having difficulty, suggest that they ask a friend or family member to help them schedule an appointment. And people who are still struggling to make an appointment can call 211 for assistance. And the state also has an assistance line for scheduling vaccines through the state's My Turn appointment scheduler. And that number is 833-422-4255. There is, as most people are aware of, concern now over the use of one particular vaccine, that's the Janssen vaccine made by Johnson & Johnson. And based on reports of cerebral venous sinus thrombosis among some individuals that receive the vaccine, the FDA has recommended that vaccine providers suspend the use of, or pause the use of that particular vaccine. The CDC, Centers for Disease Control and Prevention, is alerting healthcare providers to watch for potential signs of venous thrombosis, particularly in individuals that have received the Janssen vaccine within 3 weeks of onset of symptoms. And they're being advised to be concerned and suspicious if someone has recently received that vaccine and has either severe headache with neurologic symptoms, shortness of breath, or abdominal pain. Those could be potential symptoms of an individual suffering from thrombosis following a Janssen vaccine. So this state and the federal government, working with their advisory committees, are looking at the data. They're investigating it further, gathering more information about these cases before making any further recommendations for the states. As far as the state blueprint, our case rate and positivity rate, test positivity rate in the blueprint metric system for Monterey County still qualifies us for the orange tier, and Monterey County would need to be in the orange tier for 3 consecutive weeks and meet the yellow tier criteria for 2 consecutive weeks before moving to the yellow tier. In order to keep our case rates down, we still have to take measures to prevent the spread of COVID-19, which again, it's still wearing face coverings, avoiding gatherings, washing hands frequently, practicing social distancing, getting vaccinated when eligible, and getting tested if you've been in contact with someone with COVID-19, or if you feel sick and think you have symptoms of COVID-19. And also within the blueprint, the effective April 15th, there's state guidance for gatherings, for private events, which includes meetings, receptions, and conferences, for indoor seated live events and performances will all take effect. And so encourage people and those in those business sectors to visit the state website to look at what changes will take place starting tomorrow. And that's my update. Thank you, ma'am.
Thank you very much, Dr. Moreno. And I had sent out a tentative scheduled lineup to everyone, but we were very happy to have a late addition, and that really pleased to have a representative from Natividad with us this afternoon. I'd like to introduce Sade Alabi. She is the clinical pharmacy coordinator for medication safety. And a lot of us have been seeing these mass vaccination clinics that have been going on around the county, and vaccine management for those clinics is very important. And Sade, I'm hoping you'll be able to tell us more about how that is done. Good afternoon.
Hi, thank you for having me and thank you for inviting me. For the vaccine clinic, as everyone knows, we had a mass vaccination event over the last weekend on Saturday and Sunday. And at that event, we vaccinated almost 8,000 patients. So on Saturday, we did just short of 4,000, and on Sunday, the same. So a total of 7,899 doses were administered. So I'm planning the clinic. There is a lot of work that goes on behind the scenes for planning these clinics. And usually it entails getting the appointments booked first. So appointments open up on the Monterey County's website. Patients go on there to register for vaccine clinic. It is really crucial for patients to remember that, not to double book, because we've had instances where people double book. They have 3 to 4 appointments because they're not so sure if the first one went through. When appointments are being booked, an email notification is sent to the patient, so you do know that the appointment went through. If patients don't go ahead and double book appointments, then it takes up another spot for somebody else to be able to book an appointment. So we've had instances at the vaccine clinics where we have double bookings or we have no-shows. No-shows also cause us problems because when we bring out the vials from the freezer, the Pfizer vials are usually in the ultra low temperature freezer, the ULT freezer. When we bring those vials out of the freezer, they're good in the refrigerator for 5 days. So we are very cognizant about bringing the exact amount of vaccines that are needed for a specific clinic based on appointment registration. So that usually, with the 5 days leeway we have, if there's any leftovers after the clinic, we keep an eye on that and we make sure to schedule a clinic before the 5 days elapse. So it's when we have no-shows, it affects the number of vaccines we have left over that we have to return to the refrigerator, and we have to sometimes scramble around to make sure that we schedule, we open up appointments for a clinic before those vaccines expire. With the Moderna, we have a little bit of leeway of 30 days, but with the Pfizer, we don't really have much. So it is really imperative when patients book appointments, they show up. We also understand that things happen and patients are not able to show up to their appointments. When that occurs, then patients can go into the system and cancel the appointment so that it opens up space for another person to go ahead and schedule an appointment. So when we get the numbers for the number of appointments that are coming through for the day, we schedule staff. We actually we have wonderful volunteers that have been working. We have nurses, we have pharmacy team members, we have some of our doctors, we have some of our HR coordinators. It really does take a team effort to get this vaccine clinic going. So we send out emails to get volunteers to come to the appointment, and the clinic is usually open all day, most of the time from 7 a.m. to 7 p.m. So we have, people working 12-hour shifts, sometimes 14-hour shifts if the clinic run over. So it really, really does take a team effort to make the vaccine the vaccine clinic happen. We have people that are mixing the vaccine in real time, making sure that we're keeping up to speed with the line that does form for this clinic. And then at the end of the clinic, we take back whatever is left over, as I said previously, and we make sure to schedule appointments before those vials are due to expire. So we really, really keep a tight, close eye on the vials we have, on our inventory, on what we have in the fridge. And so far, so good. We haven't had any waste. Everything has been working out great. Again, I would like to stress that when patients schedule appointments, it's really important to show up for the appointments. And if things happen and patients are not able to show up for the appointment, we kindly ask that the appointment be canceled officially so that the spot opens up for someone else to be able to fill in that appointment time. And that way we have minimal, we can account for the number of vials. We make sure that we bring out the right number of vials to be administered for a specific clinic day.
Shade, thank you very much for giving us that behind the scenes look. I think people don't know what goes into those clinics, those large scale clinics.
Yeah.
Thank you. And then if you would stay on the line, I think we've got some questions for you.
Okay.
All of our presenters are done. And so now we'll start with some of the questions that we've got in chat. And I've got a couple of other questions that have come in by text. Our first question was about admission to Toro. And I believe that question was already answered by Brian during his speech or talk. Brian, here's another question for you. Are you able to tell us about the healing process of the burn scar? Has low precipitation this rainy season slowed or hindered the healing?
Sure. It was kind of a mixed blessing that we had, lower than average seasonal precipitation, and the rain that we did have, other than the atmospheric river, was fairly gentle. So it didn't hinder the growth of the native wild grasses and wildflowers. Most of those species are, they can get by with just, some fog a lot of times, but the lack of precipitation, I think, spared a majority of the park from erosion issues. But there's a ton of wildflowers. I'm really happy we're able to get open sooner than later to allow the public to get in and enjoy the wildflowers. They're all over the place. And a lot of the hills, like I said, are green. The areas where they backfired from the lower portion of the park, I mean, it burns so quickly and light that it's near impossible to even know that there was a fire there. So it didn't really hinder the regrowth process. Probably a little bit harder for the chaparral shrubs, manzanita, madrones, ceanothus, those shrubs, which are, drought tolerant. They would have probably fared better and come back quicker with additional rain, but we were lucky that it didn't cause a whole lot of erosion like it did over on River Road. But everything's nice and green. There's lots of wildflowers, and it's come back very nicely.
Thank you, Brian. Our next question is for Dr. Moreno. Dr. Moreno, how much of an effect will the pause in J&J vaccine have on the vaccination effort in Monterey County? Thursday marks the beginning of eligibility for 16 years and older, but only Pfizer is allowed for that age group. How does that impact vaccination efforts in Monterey County?
Thank you, Mia. So anytime we have experience a reduction in the availability of a vaccine that the state was planning on having available, it's going to have some impact on our ability to vaccinate our population at the rate that we were hoping to vaccinate at. From what I understand, the Janssen vaccine has made up a small percentage of the total vaccine that's been available to us. We haven't been receiving Janssen vaccine on a weekly basis, unlike the Moderna and the Pfizer vaccine, where on a weekly basis or nearly weekly basis, we've been receiving some vaccine from them. So I think it will have some effect just because we'll have fewer vaccines available to us than we anticipated. However, I think we do hope that the result of the research investigation into these side effects from the Janssen vaccine are done appropriately and as quickly as possible, so we can continue to work with our vaccine providers and the community to make sure that there's vaccines that are authorized and authorized for use here in Monterey County to the extent possible.
Thank you. And another question for you here, Dr. Moreno. Why did so many people skip out on their vaccination appointments at the Natividad clinic last Saturday and Sunday? And what does that say about vaccination efforts in the county, if anything?
Yeah, a good question, but probably not for me since I don't oversee Natividad vaccine clinics. I oversee the public health clinic. So maybe someone from Natividad might be want to answer that question.
Yeah, I'm happy to take that question. So I think the impression I got from the reason why that happened was because right now we have a lot of places have opened up for appointments. So we have retail pharmacies like Safeway, Walgreens, CVS. A lot of other places have opened up for appointments for patients. So patients are having to go in and book in multiple places just to make sure that they secure the spot to get the vaccine. So sometimes the patients get it maybe at a pharmacy in Walgreens, and then they already booked an appointment at Natividad, and they end up not showing up, which is why I was stressing on the fact that it's really crucial to, if an appointment is scheduled, it's really important to cancel the appointment, because somebody else might go in to try and book an appointment at the hospital, but then all the spots are filled up. So, but if those appointments are canceled because the patient got vaccinated at a different location, then that opens spots and we're able to vaccinate more people. But if we keep running into those issues, then it kind of slows us down in getting the county residents vaccinated as much and as fast as possible. Because the more appointments open up, that means we can vaccinate more people at a time.
Thank you very much for stepping in and answering that question. Next question, I believe, would be for Dr. Moreno. If the county's test positivity rates remain in the yellow tier for the next 2 weeks, would the county health consider asking the state for permission to move into the lower tier, even if the local case rate is still in the orange tier?
Thanks, Mia. At this time, I'm not planning on doing that. I don't think it meets the two criteria that the state has established for an adjudication of tier status. But we will continue to look at the data using our local data and estimating metrics. And if we think that our estimated metrics differ significantly from the state's determination of the metrics, to the extent that it would otherwise put us into the yellow tier, then that's something we could look at.
Thank you, Dr. Moreno. And I have a question here about vaccine hesitancy. Are there any groups that are hesitant to get the vaccine? And are you aware of what their concerns might be?
Sure, Mia. So at this point, I'm not aware of I haven't read any information on those groups that might be hesitant. But now that we're getting close to half of the Monterey County residents having received at least one dose, we do know that there are some reports from other parts of the country, I believe, that on vaccine hesitancy. So one of the things that we should be looking at now is to see which groups looking at the percentage of particular groups that have been vaccinated thus far, and how close we think we are to meeting the goals for each of those groups, and then determining whether or not those groups have a particular inclination to either want to wait and see before they're getting the vaccine or outright refusing to get the vaccine, because that could affect the total percentage of individuals in Monterey County that have immunity, which leads to the herd immunity, which we're really trying to achieve. So it's a good question. So it's something that we definitely need to start looking at as we start getting more and more, a greater percentage of the population vaccinated and trying to achieve herd immunity.
Thank you. And then here's another question for you. With about 50% of county residents who are 16 years of age and older having received at least one vaccine dose, how long do you think it would take to get the other half of the eligible residents vaccinated?
Yeah, good question, Maya. I think it ties into the last question that you shared just now. And I'm grateful that at least half of Monterey County residents have received at least one dose, and looking forward to them receiving the second dose if it's Moderna or Pfizer. But we do, as we move further into our vaccine efforts, we start looking at seeing what additional steps we can take to encourage people to get vaccinated. So early on in our vaccine efforts, our strategies were really geared towards trying to make as many trying to recruit as many vaccine providers that we could here in Monterey County, and making sure that every dose that was offered to Monterey County was received by one of our vaccine providers and was offered to somebody. And at that point, the demand for vaccine was greater than the supply of vaccine. So at some point, and that's because the people who got the vaccine first were the people who were very interested in getting vaccinated. They understood the benefit of getting a vaccine, that the risk of getting an adverse effect was tolerable, knowing that they could significantly reduce the risk of being hospitalized or dying from COVID-19. So those are the people who adopted the vaccination right away. And as we move forward, it's going to we may have to put a little more effort trying to educate, do outreach and educate, and make vaccine more something that more people that might be hesitant, trying to encourage them to get vaccinated. So I can't tell at this point how long that's going to take, and I really can't tell at this point how many more people are going to get vaccinated. I only hope that people that have gotten vaccinated can share their stories with their friends and their families and their neighbors, and let them know that they've gotten vaccinated, and hopefully they can also encourage those that haven't gotten vaccinated to go ahead and get vaccinated. And we here in the county will continue to with our efforts to get information out to the community about the importance of getting vaccinated, the importance of preventing hospitalizations and deaths here in Monterey County. So we still have a lot of work to do, but back to the specific question, when do I think this is going to happen? I can't tell when it's going to happen. I just know that we have a lot of work in order to reach our goal.
Thank you. And this is a follow-up question to an earlier question about whether we can, how to move into the least restrictive tier. What are the two state criteria for moving into a lower tier aside from both case rate and test positivity rate? Has that changed since the state allowed a request based on test positivity rates alone?
So in order to move into a lower tier, the criteria still remain that you have to have case rate and positivity rates that are in that lower tier for at least 2 weeks, and have to be in the current tier for at least 3 weeks. So that hasn't changed. There was a mechanism where a county could be in a tier, and their case rates their positivity rates may be two tiers lower. And in that circumstance, that's the expedited way to move into lower tier. And so that works for a county that's in either purple tier or red tier. Once you're in orange tier, there's only one lower tier. So there isn't a tier, 2 tiers lower than orange. So that expedited way of getting into lower tier is not available to Monterey County. So that only leaves the adjudication, which and with the adjudication, the 2 criteria include a data discrepancy in metrics that are significant to affect the tier status, or qualitative and contextual elements specifically provided by the county requesting adjudication. So those are things that we've periodically would look at. Our epidemiologists look at the metrics that I mentioned to see if our calculations of the metrics are significantly different than the state's calculation of metrics, which would otherwise put us into, in this case, the yellow tier. We haven't gotten to that point yet. So those are the current mechanisms that I'm aware of, and that information's on the state websites for those on the call. They can go in and read in more detail what the mechanisms are.
All right, thank you for that. And then I think this looks like it's our last question. This is about reports. One of our media representatives is asking about reports of a woman who suffered facial paralysis after getting a J&J vaccine in Monterey County. How many cases have you seen in Monterey County about with adverse reactions to the Johnson & Johnson vaccine? This person who got the vaccine was the end of March. And then is the county going to contact people who got J&J, or would that be whoever provided the vaccine should contact the recipient?
Okay, sounds like there's a few
questions in there.
Yeah, so the Monterey County, I'm sorry, so I haven't received any reports of an individual with facial paralysis following vaccination. But just as a reminder, Monterey County isn't particularly part of the reporting process. There's the VAERS vaccine adverse event reporting system that clinicians and even people who received the vaccine can report to directly. So that is something that doesn't have to come to the health department. That goes straight through the VAERS reporting process. And that's how these most significant adverse reactions got reported. Some of them got reported through VAERS. There's other mechanisms that some states use, but eventually they go through those state and federal reporting systems. But again, I haven't received any reports of someone receiving facial paralysis following one of the COVID vaccines. The other question was about, what was the rest of the question there, Maya?
The other question was about contacting people who got the J&J vaccine. The questioner was saying, should the county contact them? But is it not just the county, but it's the person who gave the vaccine, correct?
So I don't know. The CDC hasn't, from what I recall, having read the CDC guidance, the CDC isn't asking that providers contact their patients who have received the Janssen vaccine. The CDC is at this time recommending that providers who engage patients who have headaches, abdominal pain, or shortness of breath have be suspicious of a possible reaction to the Janssen vaccine, and should be asking patients if they've received the Janssen vaccine within the last 2 weeks. So that would be if a patient calls a provider with those symptoms, or shows up to the provider's office or emergency room with those symptoms, and that's when the healthcare provider would is encouraged to have a certain level of suspicion to make sure that this person doesn't have one of these thrombotic events following the vaccine. But I don't recall the CDC guidance suggesting that healthcare providers call people who received the Johnson vaccine.
All right, thank you for that. That's all the questions that I have in chat and that have come in. I'll just give another couple of seconds if anyone has any other questions to share, and not seeing any. So that will wrap up our briefing for today. Thanks everyone for taking part. Very interesting. We'll see you next week.